Welcome to the office. Hi.
Hi.
Welcome.
Thank you.
How can I help you? Wait, where are you coming from?
I'm from Singapore.
From Singapore.
Yeah.
And how long are you here for?
About 2 weeks.
Okay, what's going on?
Yeah, so I've been having I occasionally get stiff necks.
Okay.
Then I think it's due to some injuries in my history where I dislocated my shoulder, and then due to my sedentary lifestyle, I look at the computer a lot.
Okay.
And every other month I'll just not be able to turn my neck.
To the right side?
Both either.
So a stiff neck, sedentary on the computer, work-related. Not work-related, but sedentary life.
Yeah.
Let's rewind back. Back in high school, did you play sports?
Yeah, I did.
Yeah, what did you play?
Played hockey and football.
Nice. Football meaning soccer
Soccer,
football.
yeah.
Okay.
Makes
So to
sense.
be clear for our US viewers. Okay. So, and active.
Yeah,
Active.
correct.
So when did the activity stop?
Once I started working
Okay.
in 2017, 2015, 2017.
Okay. And that's your number one issue right now, stiff neck.
Stiff neck,
Shoulder.
shoulder. As in just nice before I came from Singapore, I had an episode of stiff neck as well.
Okay.
So I couldn't move at all.
You couldn't turn or you couldn't bend or both?
Both.
Okay. What else?
Occasionally I get back aches, but I think that's due to my tight glutes. But
Okay.
yeah, I mean it's just
Okay. So back is an issue
not
sometimes.
as bad as my neck.
Okay. Well, it's all connected, right? Everything is connected.
Yeah.
What happens down below affects above and vice versa. And you've watched our videos, you know kind of how I work, right?
Yeah.
And we work based on the foundation. So you're complaining up in the 15th floor of the building.
Yeah.
We need to make sure that the foundation is right. Make sense?
That's it.
Okay. Anything else I need to know about you?
I
Any
mean,
hospitalizations?
I did a reconstruction of my ligament for my right shoulder.
Okay.
So I dislocated it a few times.
Do you remember which ligament? What transverse ligament?
Exactly.
It's okay, no problem. Okay.
Yeah, but I got it fixed.
Okay.
Yeah.
The shoulder's good.
Good, but in terms of physio and getting back in proper shape,
Okay.
maybe it's about 70%.
Okay. So there's one thing that's missing though.
Yeah.
Anytime, and I've been working on extremities for 20 years, specifically shoulder, I talk a lot about the shoulder. Every shoulder case, I always start in the neck, right, to make sure the power is on. So hopefully we can get a little bit more power to the shoulder to get past that 70% threshold.
Yeah.
Sound good?
Good.
Okay. I'm going to go over your x-rays. I'm going to explain everything I see. Questions? Ask. If you're uncomfortable with anything, tell me to stop or ask what's going on, okay?
Okay.
You ready to get started?
Okay.
Let's do it. This is you, sir. This is your x-ray. This is your full spine. 24 bones in the spine that move, 23 discs in between. This is looking at you from behind. This is the right side. This is the left side. This is your side profile. The main thing you're complaining of is the stiff neck over here on this part of the body, right? Okay. And we're going to go in detail on both of them. And the first thing I want to see is your posture. And when I run the posture line, this is good news. Running your posture line, we're running it from the lowest lumbar L5. It should bisect 7 and 2. And so you've maintained your posture well. Okay, so that's the good news. And we'll come back to this x-ray. Let's go over this and let's take a look here. So a couple of things I want us to see here. Number one, I want us to see that we have a tilted pelvis on the left side. Yes?
Yeah.
Okay. And that tilted pelvis on the left side is causing this slight kink on the left side. Yes?
Yeah.
Comes up here, and then we need to figure out what's going on the top here.
Yeah.
So when someone is telling me stiff neck, right, that's usually ligamentous. But is it actually coming from the neck or is it coming lower down? What I see, it's happening from the middle of your back. And the middle of your back is the same area that controls your digestion. So looking at the foundation, we can see the left side is slightly shorter than the right side. We can see the sacrum is also tilted here on the left side. Yeah. We're going to put the numbers up and let's see what the numbers tell us. Okay. So this definitely was a trauma, an old trauma. We have a tailbone injury. We have a rotated sacrum on the left side with a rotated pelvis and a short leg on the left. So let's go over this. Your left pelvis goes AS. It goes up and it turns out. So it goes to the right. Your sacrum on the left side goes back 3 and it goes down. So that's the disconnect. And then the whole thing goes down 8 millimeters. Okay? So all of this is starting in your left hip. Okay. Correcting your pelvis, okay, will make 8 millimeters. We should be able to get it to 6. This needs to be under 7 regardless. Okay? The sacrum, between the sacrum and the pelvis, the book tells us to do the pelvis, but let's see what we find on you. Okay? So that's your number 1 issue, sir, right there. Number 2, I want to point out a small finding here. Okay, I'm going to touch your S1, your tailbone, S1. It's going to be tender. And the reason why, we have a slight spina bifida here at S1. Those lamina should form together to form the bump on the back. Yours is doing this. So it didn't fully fuse to form the bump, but it's together. And the only reason I'm pointing it out is I'm going to touch it. It's going to hurt, but it's not the cause of your issues. Okay? Does that make sense so far?
Yeah.
Okay. Now, let's take the foundation and let's work our way up, okay? From there, we got to tilt to the left. This is all undigested food, ascending colon, transverse descending. So you're not absorbing and assimilating your food as well as you should. This black hole here, this is called the Megan-Blasi. This thing here should be this big, okay? The control of the digestion starts around 6. 1, 2, 3, 4, 5, 6. That's this one right here.
Yeah.
Now follow my process for a second. I want you to look at these circles with me, okay? And what I want us to see, this one is smaller, this one is bigger. Smaller, bigger, smaller, bigger. These smaller, bigger. Much smaller, bigger. Do you see that?
Yeah.
Okay. Smaller, bigger. There's a kink here. So there was some hit, side slip. Something happened here as well. We have a tailbone injury, we have a pelvic issue, and we have something that happened here that threw the mechanics off. Now, while I'm saying this one looks a lot smaller than the rest of them, that is something we need to look at, T6 area. But where is that coming from? Let's follow it. Smaller, bigger, smaller, bigger, smaller, bigger, smaller, bigger, smaller, bigger, smaller, bigger. Right? You see it's all turned. This is a true rotated sacrum case. Cool. Let's go back to that line, the numbers. So your rotated sacrum, this is what's happening. You have a true rotated sacrum case. So that's probably what we're going to work on. This is the left sacrum. It's back on the left, so it's turned back this way. And it's taking all of these bones like that, turned. So the fix is going to start here. Number 1. Number 2, we have an issue here. Now we're going to get to your neck. You following me so far?
Yeah.
Okay. Now, when we get to the neck, what do we see? I see a T2 side slip here. So the second vertebrae has shifted to the left slightly. And that's what's throwing this neck curve off. Let's go to your side. On the side profile, we're designed to have 60-degree reciprocating curves. Overall, your curvature is good. Okay, so I'm happy with the curvature. But let's go a little closer and see what's going on here. This is our tailbone injury here, down in S3, S4. You see how L5 is tilted a lot, L4 is tilted. Here, they should look like this. So what this is telling us here, these two, this is compensation for down below. This may be a pseudospondy, S2, maybe. Spondylolisthesis is when L5, there's some sort of damage here. You did have some trauma there. L5 goes anterior to both fore and sacrum, and it's very subtle, but it is there. So this is actually more complicated than I thought. This is going to be a rotated sacrum spondy. Okay, let's continue. These discs are good. These discs are good. There was some old compression injury there, but they're all good. These discs are all good. These discs are all good. 6 looks a little bit swollen to me, and so does 2. Now, let's get the answer to the neck here. When we're looking at the neck, your discs are good. I want you to notice something though. 2, 3, number 4 is tilting back. Okay? Number 4, let's zoom in. This is 2, 3, 4, 5, 6, 7. These are the facet joints here. This is almost open. You see this one? These are open. This one is closed. So I want to look a little closer at your C4 and also your C6. And the way we do that is flexion extension. So in extension, you see how this one tilts back and this one tilts back? So I have a feeling when you're up high in extension, you have a little difficulty breathing. It's a little bit harder to breathe when you look up. And here's an answer. When you look down, they should all move forward. This one moved forward, this one moved forward. This one opened, but it didn't move forward. This one moved, this one didn't move. This one didn't move. Do you see that? Yeah. They should be tilting forward. I don't know that we're going to work on this one, but I would start at the base here. C7. So let's put it together on there. We have a potential C7, T2, T6, rotated sacrum, and pelvis. Those are the majors that I find. And why I'm pointing all that stuff out is this. You can see instead of having that forward curve, you're starting to develop a slight reversal. Right now it's straight, slight reverse. So because of that, that's why those ligaments are getting tight. So if we work on posture and curve with the adjustments, I'm going to give you your homework of the things you'll need to do to maintain it. Does that make sense? Questions? You ready to get started? Okay, let's go ahead and watch the walk. Let's walk to the corner of the room and back, please. Go ahead and walk. Yeah, he got that Singapore wiggle. You got that Singapore sling. Keep walking. And you can see how that thing drops. Keep walking, please. Keep walking. All right. Keep walking. Keep walking. You can see him swing that right leg when he walks. The short leg is on the left. He swings that right leg. You notice it? You do this. Like that. Okay. Have a seat, please. Let's get started. Starting at the base. It's a tiny one hiding. C7. C1. Subtle. Didn't break. Breaks there. Try that again. Breaks there on the top right. Breaks on the bottom left. These are old injuries. T6, 5 points. All right. There it is. Left sacrum, 11 points. but we got to bring that nerve out. Where is it? There it is. S3, S4. That was through the tilting of the scope that allowed us to bring out the nerve. It's a concept. Bring out that nerve. Where are you hiding? 1. What's that?
What does the meter read?
The meter reads heat from inflammation. So when there's misalignment, let's say, and it's causing nerve pressure, the misalignment causes inflammation or swelling of the disc, which causes pressure on the nerve, and that instrument is picking up the heat from the inflammation. So it's determining the temperature difference left to right side at every level going down the spine. Good question. More tender there. There. More pain if I push here,
Yeah.
or here.
Below.
This one.
1 second.
Not this one. Starts here. 6. Now look at his overall posture. It sucks. Sit up straight. Bring your belly button in and up. In and up. This is supposed to be your posture right here, brother.
Like this.
That should be it. But it's so uncomfortable right now, right?
Yeah.
Okay, go back to normal. You see he leans forward. Okay. Back towards me, number 5. S1, tender.
Yeah.
Yeah. S2, tender.
A bit.
S3, tender.
Yeah.
S4, tender.
Yeah.
More S4, more S3.
S3.
S3, right there. S3 on the left, S3 on the right, S3 in the middle.
In the middle.
Okay. So we have T6, we have S3, now let's get to the neck. So you made an interesting comment, right? You said that you don't think your stuff is as serious as the stuff you see on my channel, right?
Yep.
It's all relative or you wouldn't be here, man. Or you just wanted an evaluation and hang out, right?
Yeah.
Big fan? 7.
Ugh.
Yeah. 7 to the right. 3. 1 on the left. Okay. Feet together. Open and close your knees with your feet touching. Open and close. Right side only. Yeah, when he does the whole right, the whole left is shifting. Left side only. Right side is fine. Scoot back for me, please. Alright. We don't have the luxury of time with you, do we? You're here for 2 weeks, but you're not in LA for 2 weeks.
Yeah.
So when are you coming back after today?
The 29th.
29th.
I'm not leaving today. I'm leaving on Wednesday.
So I have Wednesday as well? I have a visit on Wednesday with
Actually, I
you?
booked on the 29th.
Okay, got it.
But we can explore something on the Wednesday.
Yeah. You know I'm not fixing all this in 2 adjustments, so you know that, right?
I know.
You know that.
I know.
But you got your answer.
Yeah.
I know we have a Gonstead guy in Singapore.
Okay.
There's a Gonstead guy in Singapore.
Oh, I didn't know.
There's a few in Malaysia.
Okay.
Okay. They're good docs out there. I taught a seminar in Malaysia many years ago.
Yeah.
And I met quite a few of them over there. So they can watch this video and you guys can continue the work as needed, or you come back
Yeah.
whenever you come back. Okay, let's do this.
Okay.
I'm gonna go a little bit interesting on him today. We're gonna do sacrum, we're gonna do left pelvis, we're gonna do T6, and we're gonna do C7 today. You ready for me?
Yes.
Let's get started. 1, 2, 3. There you go, sir. Shasha! Hi, Shasha!
Hi, Doctor.
How's it going? What's up?
Hi.
Was he behaving with you?
How about you?
Yeah?
Pretty cool.
Yeah?
Very nice.
S3, torque it up on that left side, then close the ASEX. You got him? Torque. Relax the shoulders, brother. That's a piece. That's the home run, baby. Thank you, Shasha. ASEX, I'm gonna be on your bum here, okay, sir? Right there. Slide up a little bit, up. I'm gonna hold the right. Hold the right, push the left, down. There you go, gotcha. Whew. It's a tough guy. That's the home run, baby. Okay, I haven't touched your neck yet. Walk it off, you okay? It's deep. Walk 3 times back and forth. Keep your head straight. As you're walking, tell me if anything is different on the low back right now. You notice your feet.
Yeah, it's not as swingy as just now.
Have a seat back over here, please. Now, look to the left, look to the right. Look straight. Okay. Center on the chair here for me, please. 7 we're going to set as A. Be all right. All the way up. So while it is it's pretty, let's relax there. Chin back. And be a little firm on that 7. And bring it in. And go right through the joint there. You got to put your hands on your lap for me, sir. And go right through. Just like that. Good. Gotcha. Nice. Walk it off, please, once. Good stuff. That's it. And I'm going to get a tiny bit more on the right side, okay? So, just not too much lateral flexion for this side. There you go. Gotcha. Good morning. Sit up straight. Deep breath in, blow it out. Walk that off one more time, please. And then I'll rescope you and continue. Good?
Good.
Good. Have a seat. Singapore sling. Hey, let's do that. That changed his upper neck. We're not touching up top. C7 is clear. T6 is clear. Lots and lots of walking, brother, okay? Still got a little bit there. Let's go right side down, please. Right side down. Let's slide down so your ankle is hanging off the edge, just to get a little mechanical advantage for him. You know, you see me sometimes, it ideally should be there, and sometimes, you know, it comes forward. In his case, I just want to take every mechanical advantage I can. There you go. Oh, Singapore got cobras?
No.
No cobras?
The zoo.
They're going to get one now. Oh. The cobra. It bites, doesn't it?
Yep.
Come on, I'm going to walk it out. Feels so good. Good stuff. Mo better. There you go. Nice.
I felt a kink over here just now.
What's that?
I felt a kink when you push
Little kink up there? Come back over here, have a seat, let's recheck everything. Make sure up is clear, make sure nothing went out, okay? No, that's just muscle. Let's do the shoulder, let me do the work. There you go. Shoulder, there you go. On your back, sir, here. Let's work on the feet. Raise your right leg. Down. Raise your left leg. There you go. Sit up and turn. Now the buff and polish. This is vibration therapy. Okay. The purpose of this is to break up scar tissue and get the tissues flowing, get a blood flow circulation, sit up straight. Look to the left, all the way. Look to the right. Different. Stand up for me, please. Use a mouse or a trackpad?
Trackpad.
Eliminate. Let's get out for it. Squeeze. There you go. Okay. All right, so the thing we talked about just now was the digestion. I'll give you something to start taking with the digestion to speed up the process. We're not going to wait to just see what the adjustment does, yeah? When you come back on the 29th, we'll have 29th and 30th.
Okay.
I may even see you two on the 29th.
Okay.
So 5-6 hours apart is okay.
Okay.
We'll probably do that, 2 on 29th and 1 on 30th.
Okay.
So you get your 4 visits.
Okay.
Okay?
Okay.
Welcome to the office.
Thank you.
You're welcome.